Hello, my name is Joan, and this is video pronunciation and definitions 1. Neuromyelitis means inflammation of the nervous and medullary substance. Myelitis attended with neuritis, which is inflammation of the nerves. The patient presented with neuromyelitis optica, a rare CNS disease. Thrombocytopenia is an abnormal drop in the number of blood cells involved in the forming of blood clots. The patient had copious amount of blood loss due to thrombocytopenia. Psychotropic is a drug that affects the mind and is capable of modifying mental activity. The pediatric patient had his ADHD treated with psychotropic drug Adderall. Narcolepsy is a disorder marked by excessive daytime sleepiness. Bob decided that motorcycle riding was not safe after suffering from narcolepsy. Arteriosclerosis is a group of diseases characterized by thickening and loss of elasticity in the arterial walls. Angioplasty is often used to treat arteriosclerosis. Endarterectomy is an operation to remove or bypass the fatty deposits or blockage in artery narrow by buildup of fatty tissue. The patient has his arteriosclerosis treated by obtaining an endarterectomy. Hemolysis is the destruction or dissolution of red blood cells with release of hemoglobin. Hemolysis was caused in the patient due to an streptococcus infection. Adrenocorticoid is any hormones produced by the adrenal cortex. The patient had to take an adrenocorticoid as treatment for metastatic breast cancer. Phenoplegia is paralysis of the diaphragm. Regular breathing was affected due to phenoplegia. Endometriosis a condition in which bits of the tissue similar to the lining of the uterus grow in other parts of the body. A laparoscopy was necessary to diagnose precisely the endometriosis. Hysterosalpingo-oophorectomy is an excision of the uterus, uterine tubes, and ovaries. A hysterosalpingo-oophorectomy was necessary to help the patient with her chronic endometriosis. Enterocholecystostomy is formation of a new communication between the gallbladder and intestine. The patient had to have an enterocholecystostomy to repair intestinal cancer damage. Orchipexy is surgical freeing an undescended testicle with implantation into the scrotum. The 2-year-old patient needed an orchiopexy to correct the undescended testicle. Pyelonephritis is an inflammation of the kidney and open urinary tract that usually results from non-contagious bacterial infection of the bladder. The patient was noticed to suffer from pyelonephritis due to cystitis. Cholelithiasis, the presence of formation of gallstones. The upper abdominal pain was due to cholelithiasis. Dorsocephalopathy, toward the back of the head. The wound from the car accident was dorsocephalad. Morphology is a branch of biology that deals with the form and structure of organisms without consideration or function. The morphology of the specimen indicated that was a cephalopod. Meningeal cell is a hernial protrusion of the meninges through a defect on the cranium. The meningeal cell was dorsocephalad. Encephalopathy. Huntington's disease is an example of encephalopathy. Encephalopathy is any disease of the brain. Lymphadenopathy is a disease of the lymph nodes. The lymphadenopathy was identified as follicular hyperplasia. Thank you.